And one day he tried committing suicide at the workplace and very, very fortunately was unsuccessful. And we called the police, 911, ambulance came, they did a 24-hour watch. The next day I was working, I was the only manager there. He knew that was the schedule, and he came into my office and locked the door and said he was really angry with me for calling the police and that he wanted to hurt me. Uh, and that was obviously a really scary moment. I spent the next couple hours de escalating and convincing him to actually admit himself into the hospital. But it's a really sad story, and I wish I knew where he was today and if he was okay. But obviously didn't stay in touch for those reasons. But very sad, and so I think that it's Mental Health Month. A lot of people are talking about, how we can better support our employees with their mental health. And certainly part of this story reflects that, right?
Mm, mm.
That we should be, keeping track of our employees. And, if, and actually the reason why I even knew about his challenges in the first place is because his manager came to me and said, hey, he's mentioned to me that he's depressed. I think, he should have a conversation with you. Managers need to step up and do that because it's really critical to kind of be there to support employees. And HR isn't going to know everything that's going on, of course.
Yeah, yeah, yeah.
Even though some people joke and say we do, we don't.
Mm.
Um, so the other thing, though, that I think often goes unnoticed or untouched during Mental Health Awareness Month is mental health for HR professionals, because we end up taking on some pretty significant emotional burdens from employees. Gladly, it's part of why we got into a profession of service, because that's how I see human resources, as a profession of service to others. Um, and I also think that there's a lack of crisis management training for HR professionals as well. So I don't know if you have any thoughts on that, Matt, crisis management, or how to better support HR professionals with their own mental health. But I do think it's really critical for key leaders across the organization to be very aware and cognizant of the fact that HR is assuming a lot of emotions that are coming their way, and it's a really tough job, and you can't talk to other people about it. It's a really lonely job, and your time is spent taking care of others and not necessarily taking care of yourself.